Hello. Thank you for joining us for this Go Diabetes webinar. Today, our title of the webinar is Team-Based Healthcare, and this webinar is being given by Mary Edery, one of the Go Diabetes lead faculty. All attendees' phones are automatically muted, so you will not be able to ask a question. However, we ask that at the end of the presentation, you use the chat function to ask your questions, and then I will read the questions for Mary to answer them. That way, this information is included in the recording. This webinar is being recorded and will be available as a link on the Go Diabetes website so that you can share this information with colleagues or listen to it again at another time. I'd like to welcome Mary. Mary Edery has her master's degree in public health and healthcare administration. She's a certified physician assistant and a registered nurse. She has a long history of clinical experience working in a variety of settings and has a lot of experience working collaboratively with clinical teams to provide care to patients. And so she has a unique perspective on team-based healthcare. Again, if you're just joining us, your phones will be muted during this webinar. We'll give you an opportunity to ask questions using the chat function, and we will answer those questions at the end of this presentation. Thank you very much for attending, and now I'm going to turn the program over to Mary. Thanks for being with us today, Mary.
Thank you, Susan, and thank you for everybody who's taking part of your busy day to participate. Good afternoon, and for those of you not on East Coast time, good morning. We are going to talk about team-based healthcare today. So we can talk about a team, and most of us have a pretty good idea of what a team is. Today we're going to talk about team practice, and as many of us transition to the patient-centered medical home model, I think that team practice becomes much more important. With declining resources, provider shortages, and the need for flexibility, the team concept just really makes sense. So right now, we have lots of people providing health care, maybe not as much overall coordination as we would like to see. And students in the medical professions are not always schooled in team practice. But there are some model programs being developed for medical students and residents currently, both at Duke, Drexel, and at AT Still. We know that part of the team providing medicine now are physicians, nurses, physician assistants, medical assistants, dentists, nurse practitioners, physical therapists, occupational therapists, chiropractors, et cetera. I'm proud to say that PAs have been schooled in team care at least since the PA profession was invented in the 1960s. I think that we need to change the culture of how we train all of our healthcare profession students. But in addition to that, there's going to be need for significant faculty development because many educators were trained under more traditional models. So as learners, we all need to learn together. The key attributes of a team include a number of things that you can see on the slide. We have to share the leadership roles. We need facilitators who are experienced in team practice. We have to look at results. And we have to have representation from all of the different team members. And importantly, it's shared accountability. It's not just one person. Key attributes include a purpose. The team really needs to decide what they want to do. They want to have a work product that comes from everybody. There's got to be open dialogue. One should definitely measure performance to see if you're accomplishing what you want to do. And again, communication. I think that the last bullet is really, really important. The most highly functioning teams will embrace shared responsibility and decision-making. So when all team members are fully engaged, they'll be more likely to fully participate. There are certain core competencies and values and ethics that we see in team care. Patients and the populations are the center of the interprofessional team. We really need to respect the dignity and privacy of our patients and maintain their confidentiality. Cultural diversity is something that should be embraced, and we should celebrate individual differences that characterize our patients and the healthcare team. It's critical to remember that the patient is really at the center and the focus of team care, because sometimes we get so wrapped up in our own agendas and how we're going to get all the work done that we forget why we're doing this work. Again, it's the patient. We need to respect the unique values and cultures not only of the patient but also of the other health team members and professions. And we want to work in cooperation with those who receive care, those who provide care, and all others who contribute or support the provision of health care. It's important to develop a trust relationship with all of the team members, the patients, and their families. We have all seen many teams in name only. For example, the physician or provider drives the machine and the team merely responds to his or her wishes, which may not be the most efficient way to function. When the other team members' views and suggestions aren't considered or are disregarded, they will lose interest and they'll probably do just enough to get by or get done, earn their paycheck, and get through the day. So without all the team members pulling in one mutually agreed upon direction, the team will probably malfunction. We need to consider ethical dilemmas and how to manage them specific to the patient population. We need to always act with honesty and integrity with our relationships with our patients, their families, and the other team members. And certainly maintaining competence in our own professions is core. All members of the team should work to what I've heard referred to as the top of their license. So what does that mean? For example, as a physician assistant, I'm licensed to practice medicine, make diagnoses, prescribe. So in working in a team, I want to have a team that embraces my training and allows me to function at my highest level. If we have nurses, nurse practitioners, medical assistants, we want to do similarly. So it's important that we do a thorough review of the capabilities of all the team members, and we may find some gaps in their skills. But this review of all the team members may also demonstrate some competencies where members of the team may be underutilized and we could be doing a better job. I'd like to see us transform the traditional family medicine practice into a fully functioning team so that we're getting all of the members of the team involved. And there's a number of different tools that we can use. Reminders on the chart, the electronic health records. We can empower the medical assistants to check fasting blood sugars, foot sensation, review meds without us telling them to do so. Order the appropriate labs and make sure that they're available. And certainly embrace the use of physician assistants and nurse practitioners, especially in the care of diabetes. So we should involve all appropriate team members in each patient visit. The practice should have a protocol for patients with chronic conditions such as diabetes, so we can train everybody to the same model, get everybody on board. Again, we can use flow sheets, electronic health record reminders. Registries are a great thing, especially with patients with diabetes. Empowering our ancillary staff to make sure that the patient has had an annual foot exam, a microalbumin, eye exams, fasting blood sugars, and A1Cs at predetermined levels. Certainly ordering labs in advance of the visit and having them reviewed by the appropriate staff prior to the visit is helpful. The staff should be looking at current medications, the need for refills and changes at every visit. And we should also provide the patient with appropriate tools for self-management, because let's not forget they're the most important member of the team. So an ideal team would set the standard for a model patient-centered medical home in your community or their community, embracing team as the model for practice, and involving everybody, including patients and their families, as part of the team to improve diabetes care. Cross-functional teams are important, and they may cut across many lines within your organization. And they may also impact many different areas of the organization, including the organization as a whole. So it's important to integrate participation of members from all parts, and you need experienced leadership to do that. Of course, your particular setting is going to determine the complexity of your team, but having a fully enabled cross-functional team may take longer to accomplish and may involve more individuals than you may have originally envisioned. So if you're the mover and driver behind this, you may have a more complex sales job to accomplish this in the long run. There's some great examples of team-based care training. Medical University of South Carolina is one, and they implemented a course requirement in 2009 that gave their students exposure to team care. They had the first-year medical students work with students from all the medical degree programs, and during a semester, the students worked in teams to solve a hypothetical patient sentinel event. And they were required to determine what was wrong and come up with some recommendations for the patient care. On this slide and the next slide, I'm going to give you some more innovative team practices. But I would hope that in any university setting with multiple healthcare provider training programs, this would already be in development or in place. This was my experience in my PA training, and when I functioned as a faculty at a medical school, we were embracing team practice. Some other examples of where team-based care training is going on is East Tennessee State University, University of California, San Diego, Loyola Chicago, Thomas Jefferson, and University of Kentucky. There are some resources that you can look to. The Interprofessional Education Collaborative has a goal of integrating members and educating members of the healthcare profession. And currently, members of that are nurses, physicians, dentists, pharmacists, and some other healthcare professions. If you want to find out more about this, you can Google the IEC for more information. The IEC does have some new initiatives. In fact, it now has a partnership with HRSA for about $8.6 million, and that's also in coordination with the Macy Foundation, Robert Wood Johnson Foundation, the Gordon and Betty Moore Foundation, and the John Hartford Foundation. And they are looking to develop a coordinating center for interprofessional education and collaborative practice. And this works well with the shift toward team-based care and the development of ACOs. The location of this center is to be announced. They actually were accepting applications through 7/20/12 for institutions who are interested in housing this facility, and they're going to award a 5-year, $800,000 grant by the end of September that will help prepare health professionals for collaboration, IDing best practices, team-based care across the country. There are certainly challenges of the current system to moving to team-based care. And as primary care providers, we all know that we're managing patients with many medical problems. It's really a full-time job to keep on top of all the things that we need to know, including more and more medical knowledge, information technology, which changes every time you blink. We're concerned about workforce shortages. We're now looking at quality improvement, not just as something we want to do, but part of our requirements for recertification and maintenance of licenses, and of course, patient safety. Our patients, when they come in, are complex. They want to, and frequently will come in with multiple issues, and they want to talk to us. They don't want just a quick visit. Frequently, a complaint that we hear is they don't feel that their needs are being adequately addressed. And I think most of us in primary care know what it's like when you think that you have finished your visit and the patient pops up with the, oh, by the way, at the last minute. And sometimes that, oh, by the way, can be the most complex issue that you have to deal with that day. So primary care providers have a great amount of challenges just to get through every day. For an effective team, you need these competencies. teamwork knowledge, skills, and attitudes. Knowledge being defined as understanding the skills and behaviors needed for an effective team and how that they are manifested in a team setting. Skills are our learned capacity and way we interact with other team members. And our attitudes are our internal states and how that can influence each team member's decision to act in a particular way. So that we know that the utility and efficiency of a team is directly tied to the members' ability to integrate various personal and situational characteristics. Each team member has to understand the technical and tactical considerations for their assigned tasks, and as well, each team member needs to understand the strengths and weaknesses of their team members and work with them, not against them. So it's incumbent upon the team to monitor all teammate activities and to diffuse potential conflicts. Through the Agency for Healthcare Research and Quality and the Department of Defense, there's a program called Team Step. So it stands for Team Strategies and Tools to Enhance Performance and Patient Safety. This is, their goal is to improve teamwork in healthcare. It helps to teach the caregivers how to understand the roles of all the other caregivers, and certainly to improve quality. It focuses on 4 competencies: leadership, monitoring situations, support, mutual support, and communication. Excuse me. Since about 2006, Team Steps has been launched by about 1,500 organizations and about 12,000 individuals throughout the country. It goes beyond just general healthcare team needs, but includes a set of tools for customizing team performance based on the needs of the team. If we look at elements of building a team, we've talked a little bit about them. So having an overall goal that you can define. Having a mission statement is ideal, but having specific measurable objectives is really important. We need to know what we're aiming to do and did we get there. You need to make sure that you have systems in place to support your team, both clinical members but administrative support. And how you divide up the labor is important, so clear delineation of the tasks and assignments of roles of your team members. So it's important in preparation to evaluate and convert your team practice to a team-based model. You need to do these evaluations. You need to make sure you have all of the elements in place to be able to do that. And certainly, are all of these written down? Are they codified somewhere so that when you bring in and orient and train new teammate members, they have a basis, they have a manual to look back at? You want to make sure that all team members really do participate in the team and that everybody is on board with this team practice. Further, we need training. So each team member needs to be trained on the functions that they regularly perform, but cross-training is also important so that you can seamlessly substitute for one another if a team member is absent for some reason. And good communication is important. I can give you a great example of a place where cross-training in the non-traditional sense would have been helpful recently. I was in my clinic. We had a new ophthalmologist who was coming in to work with us. And we have a very nice visual fields machine. And he had a couple of patients set up to have visual fields. And he came in and he rather sheepishly looked at the staff and said, "I don't know how to operate that machine." And he had never done it. He had a technician in his office who did it. We were able to get that technician from his practice to come over, show him how to use the machine, so that now he's cross-trained in the future, because in our clinic for the uninsured, we don't have a lot of resources. There was a study in 2005 by a Thomas Bodenheimer who looked at challenges to team building in primary care practices. And those included team size, handoffs, personalities of the team members, certainly financial incentives for more versus less care, scope of work dilemmas, and the varied nature of clinical problems that we talked about. He found two key elements that were challenges in the 15 practices that he looked at. And they were defining and changing job descriptions for the people on the team, and how to determine how to interact with one another. His belief that team-based care led to better outcomes, clinical outcomes, improved financial performances, and improved working relationships. And not only that, but increased job satisfaction. And we all know that leads to less turnover, a very expensive proposition. So with team building, you clearly need to begin with education. And we need to make sure that all of us have a clear understanding of the role and skills and abilities of the full team, so that the whole team works with the healthcare providers to form this effective team. We certainly all will have different perspectives, communication styles that may lead to different recommendations. But as we've said before, all members of the team really need to fully participate, and all opinions are valid. The patient-centered medical home really is an ideal environment for team-based practice. And as we know, the PCMH provides comprehensive care for everybody from children on up to the elderly. And one of the tenets of the patient-centered medical home is that there's a personal physician. It is a physician-directed medical practice. We are oriented toward treating the whole patient. We integrate and coordinate care. And there are many hallmarks of quality safety. We hope that team-based care provides enhanced access. And payment is not a dirty word. We all want to get appropriately paid for what we do. But I want to emphasize that while the patient-centered medical home says that it is a physician-directed, it doesn't mean that the physician is always the team leader. There are other providers who may be able to function in that role while the physician directs the overall work of the team. We need to make sure that our students understand patient-centered teamwork, performance improvement, and population-based care. With the patient-centered medical home, again, we're defining roles for all of the team members, and we're hoping that that allows them to work to the top of their licenses or training so that we can get maximum benefit from all of our team members. We want to ensure that team members, wherever appropriate and possible, are cross-trained, so one can substitute when we have changes. And we have to make sure we have commitments from all of the team members to help to build the team, enhance the team, and provide good communication, not only with members of the team, but with our patients and their families. Certainly there are lots and lots of challenges as we look at moving from a doctor-based model to a team-based model. And certainly we hope in the future that our primary teams will include primary care practitioners such as physicians, PAs, and NPs, that we have as part of our team medical assistants, nurses, nurse case managers, behavioral, mental health professionals, and all of our administrative staff, including our front desk and our medical records staff. So challenges to building your new team may require that there is substantial change in your structure. There may need to be changes in your HR policies. You may need to change job descriptions, allocation of resources for tools, for communication and technology, and you will really need strong leadership. These are some of the potential challenges and pitfalls. And it may be that current leadership on your teams or on your potential teams may not be able to adapt to change, or may need additional training and mentorship for the clinicians leading these teams. As I said before, a physician isn't necessarily the only team leader, but is still the overall head of the patient-centered medical home. Redesign of your teams may not be fast. It may take a while, frequently take more than 2 years. You may need to challenge and change how the organization is structured, and certainly the clinicians will need to adjust how patient care is delivered, and who delivers that patient care will certainly evolve over time. Your workflow may need to be redesigned as to who performs what functions and to which patients. You need to define job roles for both clinical and administrative staff. The primary care clinicians, we hope, will be able to focus on the complex diagnoses. Nurses, medical assistants, and others should be empowered to handle things such as routine infections. For example, a urinary tract infection in a patient who has no serious complicating medical problems is something that you may consider handing off with a protocol for treatment. Certainly immunizations, some chronic care management, medication refills, lab orders, and routine results can be delegated to someone other than a physician. So we're looking at you to be our change agents, and we'd like to see that all of us look for team practice and ensure that your practice is committed to improve. You may need to be the person who brings the group together to determine the goals for your new initiative of transitioning to a better team practice. And you will certainly need to be the facilitator for this change process. Not an easy job by any change. Managing change will frequently require you to be a problem solver and get around roadblocks, because in my experience, that's the toughest job. Someone's going to set up a roadblock as to why we can't do it, and it's going to be your job along with the team to move around that roadblock. And clearly, good communication is going to be critical throughout this entire process. So this is really going to be the biggest challenge in moving your practice to a true team-based practice. And again, it's important to emphasize that the whole team needs to be involved from the beginning. By doing that, everybody has to agree to moving forward along the lines that the whole team agrees to, and that way you can't have a naysayer along the way who says, well, I told you that wouldn't work. Everybody has to buy in to this practice. So my challenge for you in closing is, are you ready for this change? And do you feel that you can spearhead the effort to transform your practice to a team-based practice? Are you going to lead the charge to make your practice a true patient-centered medical home? And can you identify the members of your team who will be the change agents in your practice, and will you be able to collaborate with others in your community who will share a similar passion? Because certainly involving other folks and getting a support network will make this an easier job. And with that, I would like to say thank you to all of you. I appreciate your being part of this, and I would be glad to take any questions. Susan?
Thank you so much, Mary. That was very informative. And as I said earlier, so that the questions and answers can be included in this recording of this webinar, we'll ask now that you use the chat function and go ahead and write any questions, and I will be reading those as they come up. While that's happening, I would like to remind you all that, again, this is a recorded webinar. The link to the webinar will be posted on our website within a week of this session. The Go Diabetes website is www.godiabetes.org. And all of the webinars that we've had are listed under resources. We encourage you to view those at your convenience. Some of the information on there is very useful as you work through this process of helping patients who have the chronic disease of diabetes. What I'd like to do is, at this point, there is one question Mary, could you please repeat the major barrier described by T. Bodenheimer?
Let me get back to that slide. He actually had two, and give me a second to go back through my notes, and I'll get that for you. Okay, two key elements that he talked about, and they were, number one, defining and then changing the job descriptions of people on the team, and then number two, determining how the team members should interact with one another.
Thank you very much. And you cited the resource for this, so as individuals have questions, they can go to that source directly, correct?
Correct.
Great. Okay. I don't see any other questions at this point in time. Please do know that if you come up with questions on any of our webinars, we are more than happy to share information and answer those questions. You would just need to contact one of the Go Diabetes coordinators, and our emails are all, and phone numbers are all on the website. So we want to make sure you have the answers that you need. But that will conclude our webinar for today. Thank you so much for joining us. And please do go to our website and look at the other webinars that have been recorded, along with past issues of our News on the Go and deadlines for upcoming activities. Thank you much for attending. This ends the webinar.